In many healthcare facilities across Africa, clinicians make life-saving decisions with limited internet access and limited clinical resources. MedAssist Africa, or simply MedAA, is an AI-powered offline clinical decision support system that provides fast, evidence-based guidance anytime, anywhere, helping healthcare professionals deliver safer and more confident patient care. Security comes first, so access is restricted. So clinicians will have to have access or clinical access before they can actually use the app. Here I'm putting my access code. All right. So as soon as you gain access to the app, clinicians can instantly access offline medical guidance, emergency protocol dosage calculators, and AI clinical recommendations, all within a single dashboard. Now, presently, I have the clinical chart reference. With clinical chart reference, I can have quick protocol lookup. I can transfer chart straight with the AI charts by putting my clinical observations of the patient, and immediately I can run it or submit it, and I can have a response generated for me. Yes, based on the situation of the patient I have here, as contained in my prompts. Okay, as contained here, it has been able to give me a response. And the response have a clinical advisory, emergency warning, clinical evaluation, recommendation, management, and dosings, and then evidence sources. So aside the clinical chart reference, if I don't want to chart, I can use the track systems. With the track systems gives me the guidelines or emergency track. Here I can put in the relevant parameters. For example, if the patient is an adult, I can say an adult, or if it is a child, I can say child under 5. And I can select the situation of the child. Probably a child is having high fever or unable to drink or eat, maybe. And then I can put the temperature. Maybe I can say the temperature is 38.5. Okay. Then I can run the emergency track. So in the shortest time possible, less than seconds, in seconds, I can have my response. It gives me the red flag, emergency, immediate action required. Then we have the clinical advisory sheets, and then clinical evaluation and differentials, recommended management. So we have clinical evaluation and differentials, recommended management dosings, and evidence source and pathways. So aside that, we also have pediatric and maternal dosings. With maternal dosings, we can have um, the inputs based on the situation on ground. We have a general adult and patient's weight. Let's say the patient's 70 kg, and then we have the age of the patients, maybe 50 years of age, and we want to a dose for malaria and parasitic infections. Or if you have another one, we can have antibiotics and antibacterials. So with antibiotics and antibacterials, we can, of course, select other alternatives as we may have here. All right. And then we have the dosage and safety rules and dosage calculations done for us. All right. So that is with dosings. We have soap notes builder. We can have an AI subnode builder based on the inputs from the situation of the patient, and then we can have a clinical uh, standard clinical drafts made for us with the AI. And then lastly, we have the system audit benchmark. With system audit benchmark, we can select any of the benchmark that have to do with what we or the patient situation at the moment. For example, if we have a situation where we want to where we have assessments of the track signs of severe pneumonia or respiratory distress in infants under 5 years. So we run the audits. We're going to see the audits running, and then we can have it. We have the clinical advisory sheets. We have the emergency warning, clinical evaluation, recommendation, and the evidence source. Generally, MedAA simplifies documentation, which is built-in SOAP, and it also has the language change. We can actually play around with several languages or a number of languages in Africa because it's actually built for Africans, changing from Yoruba to Hausa to Swahili. Um, yeah. And finally, it is good to note that this is built for African healthcare, uh, and it works completely offline, supporting multi-languages and empower healthcare professionals to reliably work offline and have access to guidance and resources. Thank you.